All right, welcome everyone. Getting dental implant surgery is a big deal, so congrats on taking that step. But the journey's not over just yet, right?
Definitely not. The recovery process is just as important as the surgery itself.
And that's what we're diving deep into today using the Orastock post-surgery care instructions.
We want to make sure you're fully equipped for the healing journey ahead.
Exactly. You've planted the seed, now you need to nurture it. So let's jump right in. You're fresh out of surgery. What's the first thing on the list?
Well, first things first, you got to manage the bleeding and swelling. You know those gauze pads the dentist put in?
Yeah.
Those are key. Keep firm but gentle pressure on them for at least 30 minutes.
Okay.
This helps a blood clot form. It's like a protective seal over the surgical site.
So that's why we don't want to be messing with that area.
Exactly.
And the instructions also mention ice packs. Is that where the 15 minutes on, 15 minutes off rule comes in?
Yes, precisely. Ice helps reduce that inflammation, which is your body's natural response to any injury. It's a good thing, but we want to keep it in check for optimal healing.
Got it.
Yeah.
So we're keeping things clean, cold, and under control. Now, I know a lot of folks reach for pain relievers after any procedure. Anything special to keep in mind here?
For sure. Always follow your dentist's instructions about medication.
Oh.
If they prescribe something specific, stick to that.
Yeah.
And unless your dentist has okayed it, stay away from aspirin.
Right.
It can thin the blood, which could lead to more bleeding, and that's not what we want right now.
No, definitely not. Now, let's talk about keeping things squeaky clean, oral hygiene after the implant surgery. Those instructions are very clear about the first 24 hours, no rinsing or brushing.
Yeah.
Why is that so important?
Remember that blood clot we talked about?
Yeah.
It's fragile at first. Rinsing or brushing could dislodge it,
Ah.
which could lead to infection and potentially delay healing.
Okay, so hands off for the first day.
Yes.
But then things shift a bit, right?
Yeah.
We do want to keep things clean, but in a gentle way.
Yes, you got it. So starting the day after surgery, gentle rinsing with an antibacterial mouthwash 2 to 3 times a day is recommended.
Okay.
And you can gently brush your other teeth, but stay away from the implant area.
Right.
It's like caring for a delicate wound. You need to strike a balance between cleanliness and letting the area heal undisturbed.
Makes sense. All right, now for everyone's favorite topic after surgery. Food. What's the deal? What can you eat and what should you absolutely avoid in those first few days?
The name of the game is soft and cold. Yogurt, applesauce, mashed potatoes,
Okay.
things that won't irritate the surgical site.
Easy to eat.
Exactly. Easy to chew, easy to swallow, no pressure on that newly implanted area.
Okay. The instructions also mention a surprising no-no, straws.
Yeah.
Why are those off limits?
Believe it or not, the suction from a straw can actually dislodge that blood clot.
Oh, wow.
So stick to sipping from a cup for now.
All right, no straw cocktails for a while. And while we're on the topic of what we put in our mouth, staying hydrated is super important, right?
Yeah, absolutely. Plenty of water is key, but you can also have juices, teas, or clear broths.
Got it.
Just remember, no straw.
Okay, so we've got the initial soft food phase down. What comes next? What can we look forward to adding back into our diet as we move further into the recovery process?
As your implant site heals, you'll gradually reintroduce more variety.
Okay.
Think smoothies, but make sure they're seedless and not too cold. Nutritional shapes packed with protein for tissue repair.
Yeah.
Soups and broths. Just make sure they're not piping hot.
Right.
Because heat can increase blood flow to the area, and that could disrupt healing.
Got it. And speaking of things to avoid, the instructions mention hot foods and drinks, spicy or acidic foods, anything crunchy or hard. What's the thinking behind those restrictions?
All of those can irritate the surgical site, cause discomfort, or even, you guessed it, dislodge the blood clot.
Oh, right.
It's best to steer clear until your dentist gives you the green light.
So we're treating our mouths like royalty for a bit. Gentle care, the right fuel, and lots of patience. What else should our listeners keep in mind as they navigate those first few days of recovery?
One thing people often underestimate is the importance of rest.
Okay.
Your body is doing a lot of work behind the scenes to heal and rebuild. The day of surgery is for taking it easy.
Yeah.
No strenuous activity for at least 72 hours. Think exercise, heavy lifting, anything that could raise your blood pressure and increase swelling.
So put those workout plans and DIY projects on hold for a few days.
Aha, exactly.
And when it comes to sleep, is there anything we can do to optimize healing?
Sleeping with your head elevated on a couple of pillows can make a big difference.
Okay.
This helps fluids drain properly, which reduces swelling and promotes healing.
Great tip.
Yeah.
Now let's talk about some habits that can really hinder the healing process. Smoking and alcohol.
Yes.
Why are these big no-nos after implant surgery?
Smoking is a major culprit because it constricts blood vessels. This reduces blood flow to the healing area, which slows down the entire process and increases the risk of the implant failing.
Wow.
Alcohol, on the other hand, can interact dangerously with pain meds or antibiotics, and it can also dehydrate you, which is something we want to avoid.
Right. So no smoking for at least 2 weeks post-surgery, ideally longer.
Yes.
And it's best to just steer clear of alcohol entirely during this crucial recovery period.
I agree.
Now let's shift gears a bit and
Mhm.
talk about something that can be a bit worrisome after any surgery. Complications.
Mm-hmm.
Some discomfort is normal.
Right.
But how do you know when to call the dentist?
That's a great question. Some swelling, bruising, and even a little bit of bleeding are all expected.
Okay.
But there are some red flags to watch out for.
Okay, so what should send us running for the phone?
Excessive bleeding that doesn't stop after applying pressure for an hour.
Okay,
Severe pain that your meds can't manage.
got it.
A high fever over 101 degrees Fahrenheit. Those are all signs to call your dentist immediately. Also be on the lookout for any signs of an allergic reaction, like a rash, itching, or hives.
Got it. Those are definitely times we don't want to ignore. Now, I know the instructions mention something called a sinus lift.
Yes.
What exactly is that? And why might it be relevant for some folks getting implants?
A sinus lift is a procedure sometimes done before implant surgery,
Okay.
especially for those getting implants in the upper jaw.
Right.
It's basically a way to add bone to the sinus area if there isn't enough to support the implant.
So it's like laying a solid foundation before building a house.
Exactly.
Makes sense. And speaking of foundations, let's talk about those follow-up appointments. How important are those in the grand scheme of recovery?
They're crucial.
Okay.
Your dentist will want to see you within a week or two after surgery to check on how you're healing, remove any sutures if needed,
Okay.
make sure everything is progressing as
So
expected.
it's a chance to get reassurance, ask questions, and basically make sure you're on the right track.
Exactly. Your dental team is your partner in this whole process.
Mm-hmm.
Don't hesitate to reach out with any concerns, no matter how small they may seem.
Smart. Okay, so we're being gentle, eating strategically, and giving our bodies the time they need to recover. But let's be real, getting a dental implant is a big deal, both physically and emotionally.
Absolutely. It's a journey, and it's normal to feel a range of emotions afterward.
Yeah.
Some folks are anxious about healing, while others are super excited about the prospect of a complete smile again.
Right.
It's a whole part of the process.
So true. It's like riding a roller coaster of feelings.
Mhm.
And if you're feeling overwhelmed or anxious, it's important to reach out for support. Right.
Absolutely.
Talk to your dentists, friends, family, even a therapist.
Yes,
Having that support system can make a world of difference.
it really can.
As we wrap things up, I want to leave our listeners with a few key takeaways to remember as they embark on their implant journey.
Okay.
First and foremost, be patient. Healing takes time, and everyone's experience is unique.
That's so true. It's a process, not a race.
Right.
Trust your body, be kind to yourself, and celebrate those small victories along the way.
I love that.
Yeah.
And second, remember that your dental team is your biggest ally throughout this whole process. Don't be afraid to ask questions, share your concerns, and lean on them for support.
They are your partners in achieving a healthy, confident smile.
And finally, as your implant heals and becomes a permanent part of your smile, take a moment to appreciate the positive impact it can have on your life.
Yeah.
Imagine enjoying your favorite foods again without restriction, feeling more confident in social situations, and smiling freely without a second thought.
It's amazing how much a healthy smile can boost our overall well-being.
It really is. That's a wrap on our deep dive into recovering like a pro after dental implant surgery. We hope this episode has given you the knowledge, tools, and confidence to navigate this exciting journey. Thanks for listening.